SCHUR Hospital, University of Cape Town. I asked him how he felt about the world's reaction to the discovery of the new variant.
Well, disappointed and frustrated by the international response to what was a very speedy and timeliest announcement of the new variant, now known as Omicron, by South African scientists. But it's the international response that we are disappointed in. We do not feel that the travel bans are correct. We don't feel that they are evidence-based, particularly in so much as there is clearly now transmission and entry of the virus into multiple different countries on a number of different continents. And travel bans do not work in that situation and cause devastation to an economy and a society that is already under siege from COVID-19, just as all other economies are.
Of course, a lot of the economies of the other countries that have also been affected by travel bans will suffer. But explain to us in more detail why you think that travel bans, and this one in particular, is ultimately not effective when it comes to containing the virus.
Well, it's very clear that the virus is not just in southern Africa. We now know that there's been a case in Belgium in a young traveller who had been to Egypt and back via Turkey with no association or exposures in southern Africa. There are now cases being reported, I believe, in Scotland, also in North America. And so clearly the horse has bolted. This virus, this variant of concern, Omicron, is now spread internationally, and therefore closing borders at this stage is not going to help and is not evidence-based. The only time a travel ban may work is right at the very, very start of an pandemic, before it has spread globally. But once it's spread globally, there isn't any justification.
There's been a lot of talk about vaccine inequity around the world. Of course, looking at Africa, that has a much lower rate of vaccinations than, say, Europe or parts of Asia as well. How much do you think vaccine inequity played a part in the arrival of this new variant?
Well, I think that initially vaccine inequity in the early days probably did play a part in general in increasing the number of cases of COVID-19 through other variants. But in South Africa, sadly the case is that at the current moment, it's not about supply, it's about actually vaccine hesitancy and trying to get enough of our population vaccinated. Now, that's not the case for many of our neighbouring countries, some of which are involved in this travel ban, and certainly isn't the case, particularly for low-income countries throughout the world who are still facing considerable vaccine inequity. So when there is vaccine inequity, and there are more, which allows more and more cases, more severity, and therefore basically more virus to replicate, that allows the virus to not only replicate, but to change, to mutate. Some of those mutations will give a selective advantage to the virus, and if they come together to the real advantage of the virus to be able to transmit more or evade the immune system, then that will take off, and that will be the variant of concern. So in all countries where there's vaccine inequity, this is really a critical issue, that it is playing a role in the development of variants of concern.
Do you feel that actually, instead of being congratulated, South Africa is being punished for alerting the world?
I think you could easily say that. I think the whole of South Africa is both frustrated and disappointed by and angered by the international response, and particularly from the United Kingdom, the US and Europe, the European countries. And we would ask them, as our president did last night in his address to the nation, for an immediate reversal of these travel bans.